Body Interact is an immersive medical simulator based on the fundamentals of medical science and the highest standards of interactive media. To start up a simulation session, tap on the Body Interact icon in the initial screen, enter your credentials, and tap Login to enter. Now you are in the case selection area. Here you will find the Preferences button in the top left corner, where you can find more information about the application, and you can change settings such as the language, dialogue subtitles, and unit systems. Back to the case selection area, you may navigate through the cases and select one. Before you go into briefing, select the simulation duration. After you hear or read the assistant nurse briefing, press Start. To assess the patient's state and attempt a diagnosis and treatment, you can navigate several menus in the bottom.
I feel chest pain with tightness and the pain goes to the left arm.
Turn on monitoring devices such as a heart rate monitor and a real-time ECG. Move the monitors by dragging and pinch it to zoom in or zoom out. To reset the monitors to their initial position, just drag them off the screen. In the physical exam menu, you may follow an ABCDE approach and collect several data. You may also order several tests such as ECG. Just a moment, here is the ECG. Drag the exam to move it through the screen. You may select interventions or medications that will impact the patient health conditions. 1 minute. High flow mask in place. Head CT scan underway. Each clinical decision takes a specific amount of time to be performed. This progress can be visually tracked in the events list. With the video controls, we can play, pause, move forward, or backward the video every second, and you shall get an imaging report by touching the icon in the lower right corner. For example, to listen to the pulmonary auscultation, tap the physical exam button, then breathing, and then the auscultation lungs menu button. To move the object, just tap and move to listen to each of the lungs. If you wish to cancel any action you may have accidentally ordered, tap on the Cancel button on Event List. To change the position of the patient, go to Interventions, Patient Position, and then you can choose one of the following positions: Rising Bed Headboard. To return to the original position, tap the Default button. Lowering Bed Headboard. To use the defibrillator, go to Intervention and select the defibrillator or cardio version. Then, select the energy value. To defibrillate, tap on the plus button near the paddle, and then tap the Apply button. Anytime, you can pause the simulation and check the tests and medications you ordered in the action log. To continue the simulation, just tap on the Action Log button again, or the Play Pause button. Keep in mind that if you do not make the appropriate decisions in time, or if you make wrong decisions, the patient's condition will deteriorate. The simulation will end, and you will access the debriefing tools if you made the proper decisions and solve all treatable health conditions. Your patient's state deteriorates and dies. You stop the simulation by selecting Debriefing. Before access debriefing, you need to answer about the most likely diagnosis of your patient. The debriefing is a very important part of the learning process to review actions, get feedback, and improve the learning experience through the following tools. Simulation report. Check the correctness of your differential diagnosis and your simulation performance. Timeline report. To analyze all your actions together with a patient's status, step by step, you can also access the exams requested in the simulation. Performance Report. To view your performance in ABCDE assessment, diagnosis, and treatments in a detailed way, according to current guidelines. Learning resources. To access additional documentation related to the scenario. Scientific references. To access references and guidelines used to design the scenario. Rate the scenario. To provide feedback in order to improve the learning experience with Body Interact. At the end, tap on the Preferences button to repeat the case with the same conditions, select another case, or quit the application. Thank you.